We're now going to begin our talks about the upper extremity and some of the dysfunctions you can find there. We have this divided into 3 separate lectures, and this will be the first one. We're going to talk about dysfunctions of the shoulder area. So we're going to include the AC joint, the SC joint, the scapula in general, and adhesive capsulitis. So we're going to go ahead and start off with the AC joint. Now the AC joint is the acromioclavicular joint. So this is where the clavicle on the lateral side attaches to the acromion. So clavicle to acromion. What does this joint do? This joint really helps move the scapula around and keep all the structures in the area stable. If the AC joint is dysfunctional, then you're going to have some sort of immobility or some sort of instability in the area. You may even notice this in the scapular region, which is what we're going to use as our diagnostic finding. So keep stable. And level scapula. So how do we make our diagnosis? You're going to do what's called a spring test or a compression test. It's where you're going to place your hands over the patient's AC joint and you're going to spring downward. And you're also going to compress. You're going to do this on both sides and you're going to assess which joint is dysfunctional. You're going to tell that by which joint has a hard in feel. Which joint just isn't moving properly when you're springing or when you're compressing. That tells you which side is dysfunctional. So to diagnose, you do the spring or the compression test to tell dysfunction. Once that you have that, the next thing that you're going to have to do is measure the spines of the scapula. So you're going to go around to the posterior side of the patient and you're going to take both of your thumbs and measure which spine of the scapula is where. For a dysfunction, one of the spine of the scapula may be elevated and one may be depressed. You always name it based on the dysfunctional side. So in this example, let's say that you had a right dysfunctional AC joint and you notice that the right scapula is higher than the left. That means that you have a right superior AC joint dysfunction. So the next step is to measure the scapular spine. So what do we do about treating this? It's actually pretty simple. Both treatments are exactly the same as one another. There's just a slight tweak if it's inferior or superior. What you do is you're going to perform a muscle energy technique. You're going to have the patient seated and you're going to ask them to abduct their arm all the way out. The physician is going to go behind the patient, place his knee on the table underneath the arm so that the patient cannot push his arm downward. During the muscle energy treatment, the patient's isometric force will be pulling his arm down towards the table. He won't be able to go down towards the table because the physician's knee is in the way. To further engage the barrier, the patient is going to raise his arm up while the physician lifts his knee up higher. The treatment difference is all about where the hand is. If it's a superior dysfunction, you have the patient supinate their hand. If it's an inferior dysfunction, you have the patient pronate their hand. So you can remember superior supinate, or if the scapula is elevated, you put the palm up. So to write that out, we have superior dysfunction. You're going to supinate the hand, and the patient is going to try and pull his arm down towards the table. If it's an inferior dysfunction, you're going to have the patient pronate his hand, but you are still going to have him try and pull his arm down. So this is how you perform the muscle energy technique to treat the AC joint, superior, inferior. So next we move over to the SC joint. So the SC joint is the sternoclavicular joint. It's where the sternum and the clavicle attach. You can palpate this area by this notch right at the top of your sternum, and you have one on both sides. So the SC joint is where the sternum connects with the clavicle. Now, what does this joint do? It really helps keep everything stable as you're moving your upper extremity. When you're shrugging your shoulders, the joint will move inferiorly. When you're moving your shoulders forward, the joint will accommodate by moving posteriorly. So we're going to assess this joint by its motions. So one of the primary motions is the SC joint moves downward when shrugging shoulders. So it moves downward in relation to the rest of the anatomy of the upper extremity. When I shrug, the lateral side of the shoulder is up, while the SC joint is located down. So what happens when it's dysfunctional? Use some of the concepts that we talked about from the earlier lectures. Dysfunctional is just abnormal motion of anatomy. So if the normal motion is moving downward with shrugging your shoulders, the dysfunction will be, it will not be able to move like this. We're going to use this to get our diagnosis. So what we do is we go behind the patient, we palpate the SC joint bilaterally, and we have the patient shrug their shoulders. We then assess which joint doesn't move properly. Once we figure out which one doesn't move properly, that's the side of dysfunction. The next thing that we do is we measure the height of the SC joint. So we can place our fingers on both sides bilaterally and tell which SC joint is superior and which one is inferior. You always name it off of the dysfunctional side. So if the right side is dysfunctional, and when you measure it's lower down, that means that you have a right inferior SC joint. So the second step is to measure your SC joint. So how do we treat this? So we're also going to treat this with muscle energy, but it's not going to be as easy as the AC joint. There are two completely different techniques that you need to do. So for a superior SC dysfunction, you are going to use subclavius during your muscle energy technique. So how are you going to engage this muscle? What barrier are you going to put the patient into? You're going to have the patient seated, and you're going to have them move their arm backward into extension. Their isometric force will be trying to punch forward. The physician will be holding the patient's wrist and making sure that they cannot punch forward. When you're engaging the barrier, you go further into extension with the arm. So arm back is the barrier, and punching forward is the isometric force that you have the patient do. So that's how you treat the superior SC joint. Now we're going to talk about inferior. If the SC joint is inferior, you're going to use the sternocleidomastoid muscle, so the SCM. The idea of using this muscle is that it's attached to the SC joint, And when you engage it, it's going to help pull the SC joint back up where it should be. So what's the treatment position for this? You're going to engage the barrier by having the patient rotate away from the side of dysfunction. So if the SC joint is inferior on the right, the patient's going to rotate to the left. His isometric force is going to be side bending towards the side of dysfunction. The physician is going to hold the patient's head still as he tries to move into side bending towards. That causes the isometric force. So the barrier is rotate away, and the force is going to be side bend toward. Now remember, after every single technique, whether it's muscle energy or myofascial or anything else, you always have to reassess for treatment efficacy. So after the treatment, reassess by palpating the SC joint when shrugging the shoulders. The next part of this lecture, we're going to talk about the scapula. The scapula is the massive bone on the posterior side of your shoulder region. Scapula can move in many different directions. It can elevate, it can depress, it can go into protraction moving forward, it can come into retraction when moving backward. So really it just moves everywhere. So what are we going to see in a dysfunction? Well, the patient will have an abnormal function of anatomy. So it won't be moving properly when the patient is doing something with his upper extremity. That's how you're going to get the diagnosis: lack of movement. So how do you treat it? You can really do just about anything to treat this. If you're doing a myofascial technique, you just have to remember whether you want to do a direct technique or an indirect technique. So remember, if you're doing a direct technique for myofascial, you push the scapula where it does not want to go. You're engaging the barrier of the scapula. And if you're doing an indirect technique, you want to push it towards the freedom. Or you push it where it can go. So we're going to wrap this up with adhesive capsulitis. So adhesive capsulitis is just a fancy way of saying frozen shoulder. So when you have frozen shoulder, you're going to have restriction in some sort of movement plane of your shoulder, whether it be flexion, extension, abduction, adduction, whatever. The way that you're going to treat this is exactly the same no matter what the dysfunction is. This is where you're going to use the 7 stages of Spencer. So if you remember from your time at school, the 7 stages of Spencer is kind of difficult to remember. So there's some mnemonics that go around from school to school. One school uses something about an ice cream cone that I don't know. But the mnemonic that I use, and also happens to go pretty well for online med ed, is every fine cat takes an indoor piss. Every fine cat takes an indoor piss. So what does that mean? For this treatment, it's muscle energy. You need to engage different barriers throughout your treatment. So each of these letters represents a different barrier that you're going to engage during treatment. So the first barrier is the extension. Then you move into flexion. Then you do compression with circumduction. The next step is traction with circumduction. Then you move into abduction, abduction, then a deduction with external rotation. The next step is going to be internal rotation. And the final step is going to be the pump. So kind of difficult to remember, just pick a mnemonic and stick with it. So how is this likely going to show up on an exam question? They're not necessarily going to ask you to diagnose adhesive capsulitis because it's so easy, but the question may say, what are you going to use to treat it? Answer, 7 stages of Spencer. Question could say that they're going through the 7 stages of Spencer. They've already done internal rotation. What's the next step? You got to remember the steps, and the answer is pump. So just remember the mnemonic, you'll get the question right, and you can probably use this to treat some patients too. So this is the end of the first lecture of the shoulder area. We went over the AC joint, the SC joint, the scapula, and the 7 stages of Spencer for adhesive capsulitis. And that's OMM of the shoulder region.